Good afternoon, everybody. Thank you for joining us today for this launch event for our competition 24. My name is Francesca Troiani. I'm a senior program manager at SBRI. And today we will be going through this competition and give you some tips on how the application will work and how the process will work. Sorry. There we go. My colleague Antonio will provide you with some information on the SBRI healthcare program and specifically on competition 24. Then we will have Natalia and Fanny from the Greener NHS team who will give us a presentation on delivering a net zero NHS and on an overview of the competition brief. We will then have a Q&A session where you will have the chance of asking questions to both Natalia and Fanny and to Antonio. After that, Pete will give a presentation on the HSN network and how they can help you put together your application and how they can help you during the duration of the project. And then we will have two talks from innovators that have been funded through the SBRI healthcare program, an overview of the application and the assessment process, and then you will have some more time to ask more questions to our panelists. A little bit of housekeeping rules. So feel free to ask questions in the Q&A box. We will answer them both in writing or we will reply to them live during the Q&A sessions. If there's any technical issue, please write it in the chat, but only use the chat for technical issues and ask all the questions in the Q&A box, please. We will share the slides and the recording of the webinar. They will be uploaded on the SBRI healthcare website. And if you have any further question after the end of this webinar or during your application process, you can email the email address sbri@lgcgroup.com and we will get back to you. So I will now hand it over to my colleague Antonio, who's a program manager in the SBRI team that will provide you with an introduction to the program and this specific competition. Antonio, over to you.
Thank you, Francesca, and thank you all for being here today. My name, as Francesca said, is Antonio. I'm a program manager at LGC, and for the next 10-15 minutes, I'll be talking about the wider SBRI healthcare program, but also about this competition in particular and all the support we offer. If you can go to the next one, please. Right, first of all, what is SBRI? SBRI Healthcare is the acronym for the Small Business Research Initiative, which is a pan-government structure process that enables the public sector to engage with innovative suppliers. We are an accelerated access collaborative initiative in partnership with the Academic Health Science Networks, the AHSNs, and we are committed to support the NHS objectives, improve patient care, increase efficiency in the NHS, enable the NHS to access new innovations, bring economic value, and especially as part of this competition to address the challenge of meeting the net zero targets and support these innovations. Next one, please. This is a map of the funding landscape for innovations, and you can see how the SBRI healthcare spans from all the way from translational development to adoption and spread. Although in this presentation, I'll be more focusing on the early stage work, sitting on the translational development. Next slide, please. So what does differentiate SBRI healthcare from other programs? It is a source of funding to accelerate greener innovations for a more sustainable NHS. And it is also a risk-oriented program. We aim to provide a simple application form and a quick turnaround. And finally, we are supported by the AHSNs network. And I will explain a bit more on this point if you go to the next one, please. As you can see in this map, there are 15 HSNs in England, each of them covering a specific region, and they can all support your innovation and bring it to life. Later on, we'll have a talk from Pete, and as Francesca mentioned, and he will be able to provide you with more information on how they can actually support your innovations. So if you can go to the next one, please. The SBRI is a theme competition. So every year we launch a number of competitions that focus on addressing current unmet NHS challenges. And any organization, including those from public and third sectors like universities, charities, or NHS trusts, are welcome to apply. And similarly, SMEs and corporate ventures based anywhere in Europe are eligible. But just bear in mind that a very important aspect of this competition is that they need to demonstrate a significant contribution to the NHS carbon emissions reductions. And you can apply for projects that can be from 6 to 12 months and up to 50 to 100,000 pounds. Next slide, please. Here I show you what are some of the expected exit points from these competitions projects. These are described as well on the application brief that you can find on our website, on the competition website. This is not an exhaustive list. There might be other things that you can deliver as part of your project, but it's to give you an idea of what we're expecting or what we want to see on these projects. So just to name a few, for example, we have demonstrated environmental impact that the project will have on the care pathway and the delivery of care, quantified projected carbon savings, set timelines and strategy to comply with the requirements set in the NHS supply roadmap, or implementation plans and model for potential NHS regional and national scale-up. As I said, these are described on the competition brief with some additional guidance as well on the information that we want to see on your application. So please make sure that you go and read it. And now to give you an overview of our program so far, if you can go to the next slide, please. Since the program was created, we have supported over 300 innovations and invested over 140 million. And if you go to our website, you can actually see more detail about these innovations, what they are, and a selection of case studies that have gone through our program. Can you go to the next one, please? This is a snapshot of the impact of the portfolio have had so far. So we found innovations at various stages of development, as I said. But if you remember, I just mentioned that we made an investment of 140 million. And here you can see that this has actually led to 680 million raised in private investment. So we can say that for each pound invested, our project have generated about £5, further £5. And this has also led to 79 companies, organizations having sales in the NHS. And we have had 70.7 million patients involved through about 20,000 sites, either using the products that come from SBRI or participating in trials, for example. So I hope these figures give you a sense of the impact of our funded innovations and the value for money that we are delivering. Now, if you can go to the next one, please. Following up from my last slide, these are some examples of projects that we have funded in the past, which are great examples of the net zero work that SBRI has been supporting. We have on one side LabCycle on the left, which is a world-first circular plastic consumables supply chain for healthcare systems. They have been very successful in generating interest from private and public organizations, and recently they opened a new pilot plant with the University of Bath. And then on the other hand, we have Revolution Zero, that is on a mission to displace single-use medical textiles with highly efficient, reusable alternatives and the system to support them. They've also been working with world-leading sustainability and circular economy academics, including University of Exeter, UCL, and they've been commissioned by UCL Hospital and Hull Clinical Commissioning Group. May I have the next one, please? We've also received loads of really good feedback from our companies in past competitions. These are some examples from Good Boost and Therapy Box. And we also keep continuously gathering these feedback from our funded projects, so we can see what works, what can be improved, and try to deliver the best program for you. May I have the next one, please? This is a slide just to remind you that at SBRI, we don't only offer the support in competition, only offer support in competition and funding with all these webinars and workshops to support you on various topics like data and analytics, carbon quantification, or supply chain and procurement. We also organize webinars and drop-in sessions pre-competition, as well as events across our whole portfolio. Just to name a few, for example, we had the investment readiness programs, the showcase events, or webinar series on regulatory landscapes, etc. That will help you to bring your technology to the next level and network with other innovators. We also record the impact of our projects through annual surveys and reports and case studies. And of course, we wouldn't be able to accomplish these without all the support from organizations that you can see at the bottom of these slides, some of which we'll be speaking today. So please make sure to stay and to hear about how then they can support you in your journey. And next slide, please. Okay, this is my final slide, just to talk more about this competition specifically, and so you can start updating your agendas with the timings for applications. This competition is framed around 3 core challenges or categories even. We have clinical community engagement, novel business models to enable circularity in perioperative care and critical care settings, and net zero transformation across clinical pathways. We are having this event today, but the competition will actually formally open for applications on the 31st of October and will close on the 22nd of November. It will be like a 3 weeks window. And during this time, as my colleague Luis will explain later, you will have to submit a short application form and a 3-minute video. Assessments will be then held between December 2023 and January next year, with the aim to start contracts in February. This is all information you can find on our website, but we'll also have a Q&A sessions later. So if you have any further questions, you can raise them. And with these, it's back to you now, Francesca.
Yes, so thank you very much, Antonio. I would like now to ask Natalia and Fanny to talk to us about delivering a net zero NHS for a healthier future. Natalia, please, it's over to you.
Brilliant. Thank you, Francesca. If I could have the next slide, please. Thank you very much for having me here today. And what I really wanted to do was start with why. So I think, hopefully many of you here on the call, most of you on the call, are very clear as to why we care about this, why the NHS cares about this. And this is because the climate emergency is a health emergency. We know that it's already affecting healthcare of patients and the public in England and beyond, but we also know that it can impact the way that we can deliver healthcare in the future. We know that 99% of people globally breathe unhealthy air in, and we know that over 30 million people globally also die due to avoidable environmental reasons. So there really is action that needs to be taken. The NHS in England is responsible for 4.6% of the carbon footprint. And therefore, we know that we're both part of the problem, but we therefore have to be part of the solution. If we think about it globally, it's even more stark. If healthcare were a country, we'd be the 5th largest emitter globally. So this isn't just an issue here in the UK, this is an issue globally. And therefore, that's why we think this competition and also our kind of targets and our ambition to get to net zero as the NHS are incredibly important. So if I could get the next slide, please. So this is really why we in the NHS set 2 really ambitious targets. And sorry, if we could click next again. Brilliant, thank you. In 2020, we became the first health service in the world to set 2 net zero commitments. Our net zero carbon footprint, so that's 2040 for the emissions that we control directly, and 2045 for the emissions that we can influence. And we call that our NHS Carbon Footprint Plus. You may think that 2040 and 2045 sound incredibly far away, decades away, but that's why we've set interim targets, 80% reduction targets by 2028 and 2036. And that those targets are really there to remind us that we need to take action today, tomorrow, and every single day in order to be able to meet those 2040 and 2045 targets. We really cannot wait. We also saw in 2022 that these commitments were embedded into the Health and Care Act as well. So there's now an obligation for all NHS organisations to actually consider net zero in the delivery of their services. We also have now seen that every single NHS trust, NICS, has got a green plan in place. And so all of these organisations are coming along on the journey with us. And that's why we need research and innovation to get us along this journey. Next slide, please. So a little bit about the sources of carbon emissions. So for those who aren't familiar, you might be able to see the diagram on the left-hand side. And what that does is it shows us the proportion of that entire carbon footprint by the source of emissions. So you can see that there's a huge amount that needs to be done in terms of building energy, anesthetic gases, metered dose inhalers, travel and transport. But I think most significantly to note there is the huge blue area, and that's our supply chain. That's how we engage with our suppliers, our medical suppliers, our chemical suppliers, our equipment suppliers. How can we get everybody on this journey with us to really reduce all of those sources of emissions? And I think most importantly, it goes to say that the only way to reduce emissions across all of this pie chart on the left-hand side is to really think about the way that we want to deliver care in the future. Because we can only reduce emissions across all of these if we really think about new models of care, new ways of treating patients, innovative, greener, more sustainable ways of looking after our future patients. And what you can see in the table on the right-hand side is those sources of emissions on the left-hand side set against settings of care. And whilst, yes, it's very clear that in the acute setting, there's a huge amount of work that needs to be done, what you can also see is that every setting of care is involved, be that community care, ambulance care, primary care, mental health care. We need to take action in every single part of the NHS. Next slide, please. So that's why we've set these 3 challenge categories for this coming SBRI competition, which we're really excited about. And I'll briefly touch on these 3 and then hand over to Fanny. The first challenge category is about clinical community engagement. And the aim of this challenge is to seek solutions and approaches that promote clinical professionals' engagement to explore net zero and drive lower carbon models of care within their specialty and area of expertise. So this is really about engaging the workforce, engaging the clinical workforce, engaging all healthcare professionals to take action within their specialties. We've seen fantastic work that nurses have been doing, that allied health professionals have been doing, dentists have been doing, ophthalmologists have been doing. And what this challenge category is about is really helping those specific clinical communities, those different clinical professionals, those specialty groups, in identifying what practices they need to decarbonize. What are the hotspots within their specialty? How can they start to identify lower carbon processes and products within the areas that they're working on? And this really comes from us working with colleagues and really thinking that this needs to be led by those clinical groups. This needs to be led by those professionals working within those groups. It really needs to be grassroots. So that's really what the first focus of that first category is. The second challenge category is about novel business models to enable circularity in perioperative care and critical care settings. And the aim of this challenge is to explore how value or outcome-based business models for medical devices and equipment used widely in critical care and or perioperative care can be utilised to deliver long-term patient cost and environmental benefits for the NHS. And the focus really here of this challenge category is really thinking about those business models of circular economy and circularity more broadly. As I'm sure everyone on the call is fully aware, the NHS has really moved, unfortunately, through COVID and other situations into a single-use model. And where we really need to move forward is into this circularity model and really bringing in elements of circular economy to drive change. We know that perioperative care and critical care settings are incredibly carbon intensive, a huge amount of plastic that is used, a huge amount of single-use items that are used. So this challenge category is really about finding new business models, new ways of actually introducing circularity to reduce the carbon associated with these very carbon intensive practices. And the third challenge is on net zero transformation across clinical care pathways. And the aim of this challenge is to tackle known carbon-intensive areas of care to identify solutions that have the potential to make significant carbon reductions on the end-to-end care delivery. And what we're really looking for in terms of this category is looking at those high-volume specialties and also the high carbon-intensive specialties that we know are out there, and really thinking about how we can start to reduce the carbon across those clinical care pathways, all the way from kind of prevention, all the way through to discharge and rehabilitation. How can we reduce the carbon associated with those kind of investigations, tests, procedures that are done across all of these specialties, but also in the procedures themselves, and the way that the care is delivered within those specialties. And what we're seeing here really is fantastic work that's being led by trusts, by ICSs in the system. And we really want those organizations to think through, what is working, where is carbon being saved, and support innovation within those spaces. So I think we're on the next slide, and I'll hand over to Fanny at this point to take it forward.
Thanks, Natalia. Thank you very much. What we want you to do next is to be able to take you through what we would like to see from our perspective in the application. There's obviously a really strong emphasis on the different challenges that Natalia has presented to you. But just to sort of go into what sort of things we are expecting to see from applications, the first thing would be to have a really strong focus on the patient population that the innovation or innovative approach is actually focusing on, with a sort of clear narrative around how the innovation is actually going to benefit the patients. And then obviously we want to sort of understand what patient experience and patient outcomes you've taken into account in your applications, but also considering sort of the clinical side, so the clinical effectiveness of the innovative approach, but also considering the efficiency and productivity within the healthcare system. So the narrative around that will be really important, keeping the patient at the core of it. What we were looking for as well would be the sort of clinical needs that your innovation or your innovative approach would actually be addressing. And by this is a net zero focused challenge. So we expect the NHS need and the NHS challenge that you're trying to respond to be related to a sort of carbon related challenge. So it would have to be related to an issue surrounding carbon intensive practice or intervention, or something that we know that needs to change in practice. And I would strongly support a case towards the NHS net zero targets. So really focusing the core of the innovation around the sort of supporting the net zero NHS targets. And I guess the third big bucket that we're looking for is solutions that have an impact. And for this, we want to understand what your plan would be around being able to implement that particular solution or that particular innovation or approach within an NHS setting. So that kind of strategy and plan to be able to implement within the sort of desired space or the desired intended users, and how that can be scaled up across the settings to multiple sites. So then we can start to reach impact, and from our perspective, really start to see an impact on reducing carbon emissions. So these are the sort of three big buckets that we really want to be able to focus and see within an application from our perspective. If we can move on to the next slide, we sort of deep dive a little bit further into the sort of net zero sort of carbon core element of this competition, and what we really want to see, and what we would expect to have as good example of what a good application could look like. So going back to the innovation really being designed with a core focus to address an NHS challenge related to carbon emissions, and how can the focus of the innovation being to drive down those emissions. To support this, we are expected to see at least a work package that sort of supports that net zero target and that support that sort of net zero focus to really be able to demonstrate the benefit and the potential of the innovation to significantly reduce the emissions. So sort of clear description of what that work looks like, what is the kind of pathway that you're intending to sort of work into, whether that's specialty, an actual pathway, and what sort of intended recipients. We would like to see how you sort of demonstrate your progress towards sort of the overall net carbon impact and how that aligns with the target from the NHS to become net zero by 2045, and sort of how you plan to sort of demonstrate that progress towards those targets. Because we're talking about carbon and we're talking about emissions, we also would like to be able to see at least a plan to how you're going to, throughout this project, have an estimate of those carbon emissions and how they may be reduced through the innovation or the innovative approach that you're proposing. So we understand not everybody's got necessarily the data or the estimate at this point. If you do have them, then that would be great. But we expect this funding to also go towards building the evidence to support the case, but also an understanding of what kind of methodology would be available to you for this particular approach or solutions that you're proposing, and what are the kind of limitation of that methodology that you're proposing, what the assumptions you're going to use, because this is all part of the bigger picture. Because we expect to have a work package around net zero and supporting the net zero NHS into sort of carbon challenges and carbon emissions, we kind of expect to have specific and relevant expertise in that field to support that work. So we'd have to sort of consider dedicated expertise addressing that. And the last point that is also really important is to be able to demonstrate that you've got a clear understanding of the NHS suppliers roadmap that set a list of different requirements and milestones to be able to become net zero, at least from a supply chain and procurement perspective. So clear understanding of those milestones that you're going to have to comply and adhere to if you want to become a supplier to the NHS, but also how you plan to comply with the carbon reduction plans that are set in that supplier's roadmap. So a clear understanding and objectives from your perspective on how you're planning to sort of adhere with those milestones and the timeline. So hopefully that gives you a bit of an understanding of what sort of things we're looking at in terms of the challenge and category area for this competition, but also what we would like to see when you develop your application. And I think the next slide is probably all from us from a greener NHS perspective. So I'll hand back over to you, Francesca, and thank you very much.
Thank you both, Natalia and Fanny. That was really helpful. Apologies. So if I could ask all of you to come back on camera so that we can start our Q&A session. We have a few questions in the Q&A box that have been asked to be answered live. So, well, first of all, there is Helen Hunt from the West Midlands HSN that says that if anybody is in their area and wants to get in touch, they've left their contact details in the Q&A box. And then we can move on to the first question that I would hand over to either Natalia or Fanny. So Corinne asks, can the impact be with NHS Wales, for example? I noticed that your case studies are project commissioned by NHS Wales.
I guess happy to answer this one, and I guess there's some specific SBR requirement. I think from our perspective, we would like to see a site in England to be able to be recipient of the carbon impact related to this innovation. So if there's a partnership with England, that would be what we would like to see, if possible, as part of the bid.
Thank you, Fanny. In terms of eligibility, every organization in the UK and Europe is eligible to apply, but yeah, as Fanny mentioned, please make sure that there's some connection to an English trust. The second question is again for the Greener team. Why is category 2 only in perioperative care and critical care? There's opportunities to embrace circularity in all areas of the NHS.
I'm happy to take this one. So we don't disagree that there are opportunities for circularity across all of the NHS. It's really just to have a focus on for this competition. We have actually previously looked at circularity across kind of broader NHS as one of the competition briefs. So in this one, we're really focusing on perioperative care and intensive care, because we know that that is the most carbon intensive area within a hospital setting. And therefore, kind of with this funding pot, that's where we want to focus on solutions on for this competition, but completely appreciate that circularity is needed across the entire system.
Thank you, Natalia. So the next question is, are you thinking that solutions will be technical solutions, including new medical devices, or changes in practice, or a mix of both?
Again, happy to jump in, and then Fanny, please do jump in. So we're really looking for both, and I think we're looking at innovations that either do one or the other, or that kind of tackle both within the innovation itself. But we're certainly looking at changes in practice as well as kind of defined products themselves.
Thank you. When you use the term net zero, are you talking about ecological impact as well as carbon? And are you talking about adaptation as well as mitigation? Natalia, if you want to.
Yeah, again, happy to take that one. So in the context of this competition, we are focusing on net zero. We appreciate the wider ecological kind of planetary boundaries, but for this competition, we are asking innovations to focus on their carbon reduction potential. If we're talking about kind of mitigation adaptation, again, this competition is focused on mitigation. It is not focused on adaptation. That's not to say that NHS England and Greener NHS are not working on adaptation, but that's not the purpose of this competition.
Thank you. The next one is probably better answered by Antonio, but I believe that if Fanny or Natalia want to chip in, that might also be helpful. And that is from Richard. How is the funding structured?
What do they mean, Richard? If you can give more details, I can run you through the process. So our application form will be open in October, as I mentioned at the end. It will be then 3 weeks for assessment. We'll have a panel. We'll have a shortlisting through reviews that Louis will expand more later, and then successful companies will be awarded between £50,000 and £100,000 to do a 6 to 12 months project starting from February next year. And as I mentioned, there will be support in competition, there will be commissioning, but hopefully that answered your question.
Richard, if you feel like you wanted to add something, please feel free to add another question in if we have misunderstood your question or if you want further details. Thank you, Antonio. The next question is, please, could you speak a bit more about the expectations around appropriate expertise For example, could the proposals include provision for this, like through recruitment or consultancy, and if not currently available in the organization?
Yes, so absolutely. I think we recognize that this is sometimes an area that is difficult for people. Is perhaps requires some expertise to understand what data can be used, how to get access to the data, how to work through some methodology, who you may need to speak to. So we really appreciate that this is not necessarily available in the organization, and we want to make sure that you can bring the right expertise. That can also be academic expertise to kind of support your project and support the sort of development of your plan to be able to estimate your carbon emissions and your potential carbon reduction, and sort of have a plan to measure your impact. So that's where, you know, we understand that and want to sort of support the expertise to be brought in, so you can really have a strong focus on the carbon emissions and the sort of targets towards net zero.
Thank you, Fanny. Next question is for Antonia. Please confirm how payment of the funding will be made. Is this to be reimbursed or paid in advance at stages?
So you will have to set an invoice at the start of the project, and then will be paid. That's a standard SBRI process. So it won't be, yeah, you will have to raise an invoice that then will be paid in advance at this stage, at the first stages for the project.
Yeah, just want to add something to this. You can familiarize yourself with the development agreement on our website, where some of this information will be written. And also, please, for everybody who's planning on applying to this competition, read through the agreement, because by applying, you're automatically agreeing to the terms of the contract that are not negotiable when for the project that get awarded. So the next question is from Luke. Sage Tech Medical provided circular economy solution to capture and recycle the pollution from waste anesthetic volatile gases with an estimated 10,000 tonnes of CO2 emission per year in the UK. We previously won an SBRI grant, but we had to unfortunately decline to the agreement terms, which had claims over our background IP. Has this claim to company's background IP been removed from the agreement terms? As I mentioned, so the IP, we tend to have the IP, let the IP rest with the organization who has developed it, but the NHS would, NHS England would have some provisions over it. So just please read the development agreement, and because again, it cannot be modified. So please read through it. If you have any specific question over the agreement, please drop us an email, and we will go through it with you and see whether there's any clarification that can be done. Next question. Do you have any example of projects that would be eligible?
There's many different projects we can think of. I think we're really passionate about hearing any innovative approaches, solution, technology that you have that would respond to a clear issue. We've got 3 categories, so it can be really broad, but just thinking of clinical transformation, where we've identified the sort of high volume pathway or interventions. And if the innovation is really developed to respond to the carbon issue, to the sort of you know, to the interventions that we know is intensive, and an innovative approach has been developed and considered to reduce the impact, considering the whole pathway. And that's a really important part, because if we just focus on the actual intervention, we're not necessarily taking into account the sort of impact that the change in the redesign of the pathway, or that innovation being implemented in a pathway, could have elsewhere. So it really needs to be taken into account from a whole delivery of care perspective. So that could be, a product that significantly reduce carbon emissions, or looking at how clinicians can be empowered to reduce emissions in the day-to-day care. So there can be lots of different projects from our perspective.
Thank you, Fanny. Next question from Helen. Is demonstrating changing patient pathways and removing journeys good enough as an outcome?
I think kind of the easy answer is probably kind of yes, but it really does need to be kind of, developed in detail in terms of what the improved kind of patient outcomes are, the patient benefits are, as well as the kind of the carbon reductions associated with reducing care miles. So I think it needs to be kind of thought through in the kind of the grander scheme of things. But Fanny, I don't know whether you want to add anything on that.
Yeah, completely, Natalia. I think it's really sort of considering the innovations from lots of different perspectives. Sometimes we focus on travel, which is a critical part of emissions, but I think we really have to consider how the patients are going to be cared for and looked after. So yes, potentially reducing travel is a core area, but I think any innovations could potentially argue impact elsewhere in a pathway as well. So I think what we would recommend is for you to really sort of sit down and assess how the innovation is going to fit in a care pathway and where the impact could be. This impact could be actually increasing carbon in some area and reducing it elsewhere. So I think it's really a net approach. Just be very honest and frank in your assessment of why you think those emissions could be reduced, but really sort of looking at lots of different parts of the pathway. That could be that a nurse needs to actually visit a patient at home if the patient is sort of remotely looked after, if there's some sort of digital innovation. So we really sort of would support an overall assessment of that care pathway and using the innovative approach or solution that you're considering.
Thank you, Fanny. Next, not a question. Emma from the Wessex HSN has left a link to contact them if anybody is in the area and wants to get in touch. Richard asks, can a project submission be related to a medical device which addresses care pathways, with a specific emphasis on net zero? Natalia or Fanny?
Yes, I'm happy to take that. Yes, if there's a specific emphasis on net zero, I think what we really want to see is an approach or a solution that is really sort of considering net zero in mind. Obviously, we've got to respond to clinical needs and clinical challenge and patient care and patient safety, and that's core to what we're doing. But it's really sort of understanding that this potential medical device is being developed to also respond to a need of a carbon intensive practice. So I would say, to really consider if the case is both related to the patient care and the carbon challenge.
Thank you. Andrew asks, can this competition be used to promote and amplify existing low carbon strategies, or do they have to be novel? Fanny?
Yes, I'm happy to take this one, and then please do chip in, Antonio or Francesca, from an SBRI healthcare perspective. They've got to be innovative solutions, so it's not necessarily an implementation and scaling up initiative. Is really to try to stimulate new innovative approaches to respond to the carbon challenges that we've got as a healthcare system. That could also mean actually looking at an approach that is used in another industry and that has not actually been tested and tried in a healthcare service. And we would consider that as an innovative step, because it would have to be actually tried and tested in the NHS. So that's another thing that I can think of. That it's not necessarily a pure novel approach, but we've got to understand that our challenge can also be responded by looking at other industry and other sectors and sort of sharing learnings. So hopefully that helps. It's not an implementation sort of scale-up fund, but we're sort of open to where the innovation comes from and how we can support this low-carbon alternative to being impactful in the NHS.
Thank you. Antonio, is there anything that you want to add?
No, just mirroring Fanny's comments. Innovation doesn't necessarily come from inventing a new strategy. They can be also through applying these to care settings or reducing the NHS carbon impacts. So yeah, in principle, you could do that for your application form.
Great, thank you both. Do you have a preferred methodology for how the carbon impact should be measured?
I guess what we would say, and Natalia, please feel free to also chip in, we don't have a standard methodology that we would necessarily recommend. It also depends on what the innovation is. I think, if you've got a digital tech or like a hardware device, or if it's a slightly different approach that sort of look at sort of the whole care pathway, there's a number of different links that we would recommend, things around the greenhouse gas protocols and some standards that have been published, or the approach on the care pathway that the Sustainable Healthcare Coalition's developed. So there's a lot of different information that you can potentially use. So we wouldn't have necessarily a set methodology that we would recommend, but there's information, and perhaps that's something that we can put in a slide that's been sort of discussed before, if that would be useful.
Thank you.
Yeah.
Next question is, will you put more emphasis on reducing carbon identified as Scope 1 emissions over 2 and 3, or are they treated equally?
I'm happy to take this one. They're treated equally for the purpose of this competition.
Thank you. The next question is, primary care often seems to be a neglected area for investment in these competitions. Is primary care funded on an equitable basis? 20% carbon footprint of NHS is in primary care.
Happy to take this one as well. So category 1 and category 3 are open to primary care solutions. In terms of whether primary care itself is funded on an equitable basis as a result of the competition, the funding is awarded in regards to the outcomes of the applications and the scores related to the applications. So we don't look in terms of trying to make it equitable across each specialty and each setting of care. Rather, we fund the strongest applications that come through the competition. But primary care is 100% eligible for both the first and third category.
Thank you. Emilio asks, when you talk about net zero, are we considering reduction of carbon emissions by cars as well?
So I think we touched on this in a previous question as well. So if it's in consideration of kind of cars that travel to and from the NHS estate or are involved in NHS services, then yes, we are talking about the carbon emissions associated with those.
Thank you. Next question. Sorry, they just keep moving around. Right, found. Richard asks, are consortia collaborations eligible? And if so, are there any structural limitations? For example, on numbers of public versus private bodies? Antonio, would you like to take this one?
Yes, absolutely. Collaborations are eligible. You can work with any kind of organization. Just bear in mind that the contracts will be done with the lead applicants, and so the payments will go to the lead applicants, and all the rest of organizations that will be working will be treated as subcontractors. So there will be the responsibility for the lead to pay them. But absolutely, collaborations are eligible to apply otherwise.
Thank you. Next question would be for either Fanny or Natalia. Would tackling air pollution and emissions fit the criteria?
Yeah, I think that's probably one that we sort of touched on a little bit before, with sort of travel and emissions related to car going to between NHS estates, but also potentially the sort of well to tank emissions as well to take into consideration. So hopefully that answers that question. So yeah.
Pete asks, what are the expectations around completion of the competition? As in, is it expected that the innovation be ready for market, or to some extent are we field testing the innovation within the competition timeframes? Antonio, would you like to take the one, or Fanny?
Yes, I mean, from a net zero perspective, we understand that, you know, it's not necessarily easy to build a case using the evidence around your carbon emissions. So, you know, I think what we're really expecting to see is a step towards gathering the evidence and sort of reducing the risk of the kind of unknown, of reducing the risk that your innovation could have on carbon emissions if it was to be implemented. So we're really looking at sort of testing and evidence gathering from a net zero perspective. Antonio, I don't know if you wanted to talk about other aspects of the funding.
Yeah, no, I think I touched on this a bit before, the exit points and things that we're looking for. You can find on the brief competition that is on the website more about, yeah, all these expectation of completion. So yeah, kind of what Fanny said, more about de-risking, not necessarily implementation or being ready to market, is what we look for. This.
Great, thank you both. Next question from Simon. Are there any resources to understand and quantify impact of single-use plastics and carbon footprint of specific clinical care pathways? We used sustainability consultants. They can be part of the subcontractor element of the application.
Yes, so I guess that's probably to build onto your question that came a bit earlier, of bringing the right expertise. If that means that you've got access to specific expert sustainability consultant to sort of guide that quantification piece, I think that would be accepted as part of the funding. But I guess it's really important to be able to assess what that quantification piece looks like, to just make sure that you assess whether you've got the right evidence, what the limitations, what the assumptions are, what are the boundaries, and to be able to make that assessment. And to some extent, we will be expecting for you to be able to provide that, because we want to understand the kind of boundaries of that quantification piece around carbon. So so yes, that can be a subcontractor, but just it's just a reflection on who to work with.
Thank you. The next question asks, do the application for category 1 be disease or provider specific, or both?
I'm happy to answer that. So for category 1, I would say that we're really looking at kind of profession specific. So, you know, whether that's healthcare professionals, so, you know, dentistry, nurses, allied health, or whether it's also kind of clinical communities, you know, whether that's obstetrics and gynecology, pediatricians, those kind of groups, as opposed to, sorry, I've lost the question. It's kind of moved away from me now. As opposed to kind of specific disease specific, that fits slightly better in category 3.
Thank you, Natalia. The next question, oh, I moved, sorry. So the next question is, we are a carbon accounting platform with a difference, provides solutions, supplier access and factory library. Does this fit criteria for submission, and in what bucket would it fit? I'm not particularly clear on the question.
I think from a carbon accounting platform, I could see that as potentially a partnership with a potential solution that would fit one of the three categories. So I would say, you know, if that's sort of related to an innovation that can be applied and have a direct impact to some of the categories we've identified in the challenge, then yes, that would fit in the sort of challenge brief. But as part of the application process, I believe that we will be sort of looking at how the innovation fits the brief and what sort of category you would be able to tackle for that innovative approach. So it's important to be able to identify what exactly is going to be the impact of the carbon reduction. So it's worthwhile thinking about that, and whether there's any partners to work with that is more directed to a specialty, a care pathway, a sort of specific intervention. So hopefully that answers the question.
Thank you. And one more question before we move on. Is mental health being considered here too? Discussion, very clinical, product-led mental health may not necessarily require equipment and may require more well-being type innovations than support recovery and net zero, for example, education trails or recovery gardens and exercises. Mental health also seems to be a neglected area for most grants and competitions, often due to the invisibility of what is required for recovery. Fanny or Natalia?
I would say yes, definitely. We know mental health is associated to a huge amount of carbon, and we also know that the climate change has got a massive impact on mental well-being. Yes, sometimes the innovation funding comes across very sort of clinical or product-led, but mental health it's definitely a clinical area that we would like to concentrate on, and we would welcome innovative solutions and approaches that would tackle the high carbon intensity of this sort of pathway and sort of mental health generally speaking. So yeah, I think that's something we would take into account, definitely.
Thank you very much. Well, I would like to thank all of our panelists today. So thank you, Fanny, Antonio, and Natalia. You've been greatly helpful. And I would like to then move on to our next session. And I'd like to welcome Pete Waddingham, the Net Zero lead, who will give a presentation on how the HSN can support a Net Zero NHS through this competition. Thank you for joining us, Pete. Here's over to you.
Thank you. No, you're very welcome. And probably it was good to listen into this last Q&A session. It might help just shape my presentation slightly. But next slide, please. And I'll just whip through what I was planning to talk to you about. Sorry, let me just move the questions on the screen. So yeah, what I'd like to do just really briefly in these 10 minutes, I just want to explain a little bit about the role of the HSN network and local HSNs. I know Antonio just did a very quick sort of overview at the beginning. I want to highlight some examples of support from the HSN relevant to this competition. Obviously, I can't go into full detail about everything that we do, but hopefully just give you some snippets. Just to provide some thoughts from my perspective on the SBRI competition. As I said, I was listening intently to the Q&A session, which was really helpful. Just give you a quick example of a piece of work that I've been involved in, and again, why that might be an example and relevant to today's discussion, but hopefully more importantly, just ensure that people know how to contact me and some of the colleagues that I know that are already on the call as well. who are leading on sustainability or working with innovation teams across the HSN network. So that's what I was planning to do. So next slide, please. So just in terms of who we are as an HSN network, there are 15 HSNs up and down the country. We try and be that voice of health innovation and try and act as a kind of interim between the NHS, industry, academia, and the third sector and local organisations. We have got a great website. I think I'll put this on the next slide as well. We are about to go through a rebrand and a name change, but do have a look at the website. If you're not familiar with who we are as a network, do start with the overarching HSN networks landing page, because that'll also take you to other HSNs. So next slide, please. And just Antonia just put this on earlier on, but as I said, there are 15 HSNs. We're all sort of geographically bound. Now, in theory, it's good to connect with your local HSN, as in, you know, that might be where you are based as an organisation. It might be where you've got more of a customer base. There's not necessarily a hard and fast rule. Each HSN have some, you know, different offerings, but again, we can help you navigate that. But, you know, largely it makes sense to connect with your HSN that's in your area, and hopefully, and again, not an easy task, but we try and spread some of that innovation throughout the system. So we're a network of networks, and I lead at a national level on net zero, but heavily linked with my colleagues. And in fact, we met yesterday, and we were coming together on net zero and all the great work that's happening so far. Next slide, please. Just in terms of, and I've got a few more thoughts on this, but I thought I'd take this straight again from the website, but some of the support that we offer to innovators, and there's just 4 kind of nice headings there that I'm going to whip through really quickly. But, you know, a bit like what we're talking today, we help people sort of navigate that funding landscape, and then obviously try and help innovators access that funding. You know, that's not an easy task either. So just providing that advice on where the money is, how to complete the application, what good looks like, etc., etc., etc. The second one, I think, is really important: navigating the nuances of the health and care system. I've been in the NHS for sort of 15 plus years and supported the NHS in amongst that time as well. And there are nuances and there are local sort of variations, and I think that again is the beauty that the HSNs bring. You know, try and make sure that we've built those relationships on a local level, that we understand those nuances, because as I said, it can be very important for adoption of innovation. I'll just jump over the next one, but the last one I'm going to touch on, because I do think it's important. Obviously, we've been talking a lot about carbon accounting, and I'll probably make reference to this again in a bit, but there are methods, as Fanny said. We've been sort of heavily involved in this. We're aware of you know, different sort of methodologies and where some of those numbers exist, and actually, you know, a lot of the groundwork has been done on this, and we know where some of these really credible sources are. So I would encourage anyone, I think I put it in the chat, you know, when it comes to building you know, the evidence base from a carbon perspective, please reach out to us, ask us. But this isn't just about carbon. There's a nice phrase that often gets branded around called the triple bottom line, or the 3 C's, that I've also heard. We think about carbon, cost, and clinical effectiveness. So actually building that business case is multifaceted, and we need to help you to develop that. Next slide, please. Thank you. Again, just some of the areas how we support the health and care system. And again, this is probably both from the system and the innovator's perspective, but just on the left, you'll see some of the clinical areas that we've been involved in. And obviously, when we're talking about clinical transformation, you'll see some big areas, and I've worked in a few of these, like cardiovascular disease, respiratory, mental health just being mentioned as well. So there's some really big clinical areas in there. Wound care as well. We're doing big sort of programs around wound care, and again, there's carbon implications to all of these, and certainly some of these areas have already started giving thought to the carbon impact, which is brilliant. And then you've kind of got the cross-cutting themes as well. And obviously what we're talking about today, the environmental sustainability, is one of those cross-cutting themes. But actually there are other important areas to consider. And I think any nice innovation gives reference and thought to those other areas. It's always nice, you know, when we work with innovators that can see that bigger picture. So again, HSNs can help you navigate that landscape and just think about the wider impacts because, as I said, it's, you know, we'd all love to fly our own flag of net zero, but equally health inequalities, impacts on workforce, patient safety, they're all massively important. Next slide, please. I'm glad I only included this small snippet because it's been talked about now, the three sort of categories. But, you know, the thing I just wanted to say here when I looked at this competition is I genuinely thought there's absolutely massive scope. I think, you know, those three areas, those three challenges that have been identified really do bode well for some great innovative, creative thinking. So I think clinical engagement is an area that absolutely is needed. It came up in discussion in a panel that I was on last week. We've heard about circularity in those two areas, perioperative and critical care, but the clinical transformation as well, as I said, covers multiple pathways and parts of the pathway. So I think there's just lots to go at, and I hope the enthusiasm today is within you all just to try and put forward some of those ideas. Next slide, please. Yeah, just again, some sort of final thoughts from me in terms of what we do as an HSN, where I think we do it quite well. But, you know, brokering relationships is absolutely fundamental. So obviously we need to try and find NHS colleagues that are willing to test innovation and try. And again, that's not easy because of the pressures on the NHS. But I do think there is strength in collaboration and collaboration across innovators as well. I think I often see that working quite well. And again, Fanny just mentioned it in her response to one of the Q&As. So, you know, we help broker those relationships, and hopefully, as I said, that adds some strength. We help ensure that you can articulate the need and the challenge. And again, I've touched on it briefly already about the quantification and not just carbon. But it is really important when you're putting forward an idea that it definitely meets, you know, a known need. And again, we can sort of give some indication about the scale of that challenge and that need. And there's lots of brilliant information out there, but sometimes it just requires a little bit of help navigating it. And the third one I really love doing, and again, it's not easy either, but just acting as that critical friend on ideas. You know, is it innovative? And what are the risks to it? What could prevent this from being adopted at scale? So sometimes and often we sit down with innovators, and I certainly do. And often it might sound that I don't like what they're doing, but it's just really to think through what could go wrong with this and why might this idea not float. And we obviously help look at the wider landscape, the funding landscape, and that's useful again because, you know, as much as I'm sure SBRI would love to fund everything, that's not always possible. So some mitigation potentially, but also what we want to see is these innovations grow. HSNs often help with evaluation work, and again, that spread and adoption piece. And the last thing as well, I think, you know, is we help manage expectations, because innovation does take time. You know, we need to support innovators on that journey and just provide that sort of hand-holding. Next slide, please. Last couple of slides just from me. I organised a Green Hospitals session last week. It was really good. We showcased 50 innovators, some of which were previous SBRI winners, and some other innovators. Next slide, please. We looked at 4 themes. And again, you could probably see that some of these themes might be relevant to this call. But the reason I just wanted to highlight this is really, you know, as I said, we're here to be a window to some of this innovation, but also we know that some of this innovation is early. And just by showcasing and talking about this work, we're starting to really make some great connections, which will be vital. And it's actually really timely that this money's now come out. So I thought that was a nice fit. And as I said, we showcased lots of innovators, and some of those were the SBRI winners. And I know one of them was successful last night in the Innovate UK Awards Net Zero Award, which is brilliant. So again, you know, we want to help you really fly the flag for the great work that you're doing. Next slide, please. So finally, I just wanted to leave you with really how to contact me. There's my email address. If you want to chat, you know, that's access to my calendar. You know, I'm here to try and help. If you want to connect with me on social media, there's my LinkedIn. But more importantly, I can help you connect with local HSNs. And as you've seen in some of the Q&As, my colleagues have been putting their details in already, which is brilliant. So good luck. And yeah, I hope to see some great innovation.
Thank you very much, Pete. That was very helpful. Before I move on, just wanted to mention that there's another HSN contact in the Q&A chat that is from the Northwest Coast HSN, well, the Innovation Agency, HSN, in the West Coast. So please have a look at that if you want to. And then I would like to move on to Nathan Moore, who's the director of Primum Digital, and is here to give you some advice on and to tell you about his journey. So over to you, Nathan.
Thanks so much, Francesca. Can everyone hear me okay?
Yeah.
Brilliant. So as Francesca said, I'm a clinician by background. I was a doctor for 8 years before I moved to health technology full time. Next slide, please. So our innovation is all about clinical pathway redesign, trying to make the most clinically effective pathways at reduced financial and carbon cost. So I think that probably addresses quite a few of the questions I saw in the Q&As. You know, what sort of things can be done? Digital pathway optimization is one of them. What we did in our net zero competition was we partnered with Birmingham and Solihull Integrated Care System, one of the largest ICSs in the country, to completely redesign 30% of their workloads through all their MSK primary to secondary care pathways. And then we went on to partner with Keele University, York Health Economic Consortium, to do a randomized control trial to look at the clinical effectiveness of these pathways in conjunction with a budget impact analysis for the financial side and a carbon impact analysis. Then on top of that, we then built a real-time carbon budget impact analysis system that provides feedback to the ICS on the carbon, financial and clinical effectiveness of their pathways in real time. So next slide, please. So our system essentially is a platform for ICSs and hospitals for any clinical flow in primary or secondary care or even clerical flow, map out what is the ideal flow for these patients, build it in a sandbox test environment, get it tested, go through a sign-off process to meet clinical governance requirements, deliver it into the frontline care, into the GPs right in front, into their EPRs, into the secondary care EPRs, so you can just standardize what's happening at scale and measure in real time all the data insights from that, just to try and get things a bit better. I mean, what we found in our study was, you know, primary care and the generalist under immense pressure, and about half the time they may make decisions that the specialist may not agree with, which might result in unnecessary appointments, patient journeys, unnecessary investigations. And being able to change that at scale was really great for us to do, and we're currently getting that all assessed at the moment. Next slide, please. So you're probably all thinking, why would I apply for this? It's a lot of work, what's going on? And I'd say there's just an immense amount of benefits to applying. You know, from a really boring point of view, just filling in the form for the application will make you consolidate so many of your ideas, and the questions in those forms come up time and time again. So we're live in over 50 NHS sites now, and touch wood, another 200 in the next year. And whether it's a tender competition or it's trying to talk to a CFO of an ICS, whatever it is, the answers you write down in that form will be usable again. It really helps you just consolidate all those challenges and boxes you have to tick to get anything through NHS procurement and in the hands of the people you want to help. You do get a panel of experts to look at your application, which, you know, challenges your assumptions, and you'll get feedback. That independent validation is really good. Some of you will be looking for raising funding. So whether you go to look to investors, they'll be looking for indicators of potential. So lots of investors will say, well, the NHS doesn't give money to anything, so if it's giving money to you, it's probably a good idea. So it does also support your business case, and you'll find that opportunities spiral out of the sort of thing you wouldn't even think could be possible. Next slide, please. So tips on applying. We've been really fortunate and won 2 of these competitions, and I'd say that the basics are really important to get right. Just read the brief and then, you know, reread it. Whatever you write the first time, it's going to be wrong. Get lots of people to read what you've written, get friends, family, anyone. The more criticism, the better, because you're quite often so close to the problem, or sorry, so close to your way of solving that problem that you don't necessarily communicate it very well. You've got to write a compelling story. You are trying to make a system work in the NHS. Number one, it's got to be clinically effective. otherwise clinicians just won't use it. Number 2, it's got to be cost effective, or the managers won't procure it. Then number 3, it's got to be carbon effective as per the point of this competition. So I would say as well, try and get an MVP out as soon as possible, because your assumptions are going to be wrong. Your solution is wrong in some way, and I'm sorry to tell you, you're going to have it hit the hands of users and get used to be told that it's wrong, and just adapt, make it better. Next slide, please. So lessons I've learned, the most important thing I've found with getting a system at scale across the NHS that actually gets used is, it sounds a bit obvious, I suppose, but winning hearts and minds is just so important. You've got to develop those relationships with key people. You've got to get that light bulb moment turn in someone else's head going, oh, that's actually a good idea. I get it. I'm going to support this. And this links on to the next step. There's only so much you're ever going to be able to do as a commercial body or externally without NHS champions within whatever organisation you're trying to support, supporting your solution. And they work very, very hard, that you have to help them get through so many hurdles, but nurture those champions, because they are make or break for you. On that note as well, you need to be agile. So listen to that reward feedback. As I said, your solution is not going to be right. You've got to be able to pivot. And sometimes life happens to your plans, your team. You've got to have a plan B, and the SBRI team are really supportive. If plan A doesn't quite work out and you can propose plan B, they're very receptive to listening and taking that forward. I'd also say that you've got to go top down and bottom up in the NHS. So get your clinicians on the ground to buy into your solution, but you also have to go top down, or they won't be given the resources they need, like time, to actually make it happen. Next slide, please. So SBRI Healthcare and NHS England, the workshops they provide are pretty fantastic. They address lots of the common pitfalls you're going to come across. You do get access to the NHS Greener team and see their perception of this huge challenge they've got to try and help address, and you're going to help them address it. So the PMO support, as I mentioned as well, is really good, helps you form that really strong value proposition. And I would say that you really should try and get NHS customer as a partner, because they're ultimately who you're going to be trying to please to get this solution validated into the world to help people. So that's me. Next slide, please. So if anyone's got any questions, feel free to reach out. I am talking at the Delivering a Net Zero NHS event at the RSM in London next Wednesday on the 27th. If anyone wants to hear more about what I'm up to, or just say hi face to face, more than welcome. But no, thank you very much.
Nathan, that was very helpful. So our next speaker is Kath Richards. Kath, are you there?
I am, yes.
Brilliant, thank you. Well, in that case, please, over to you.
Thank you, Francesca. Hi everyone, my name is Kath Richards.
Oops, sorry.
That's okay. I am the Sustainability and Quality Improvement Lead at the Centre for Sustainable Healthcare, and also led the main kind of work programmes in terms of our SBRI Phase 1. So our Phase 1 project was called Net Zero in Your Hands, as it focused on the commercialisation of our programmes at CSH that deliver education and practical support to healthcare staff to transform their own clinical practice. If you could go on to the next slide, please. So very briefly, the Centre for Sustainable Healthcare, we're a registered charity. We develop knowledge and resources that support NHS staff directly and other healthcare systems to reach net zero carbon and wider sustainability goals. We were founded in 2008 and are a leading institution on sustainable healthcare research and practice. Our sustainability and quality improvement programmes are really designed to mainstream sustainability within clinical areas, so that it's integral to the planning and delivery of healthcare systems, and to embed sustainability into the practice of healthcare professionals. And our work in the Sustainability and Quality Improvement Programme is supported by our education and carbon modelling team as well. So the two programmes and services that we wanted to look at commercialisation for with SBRI funding phase 1 was our Green Teams competition. So this is a programme where we're commissioned by healthcare organisations to work directly with healthcare teams. And through a mentoring programme, we support teams to design, implement and evaluate sustainable changes in their clinical practice. This is over a 10-week period, project phase, which culminates in an award ceremony. It's an exceptionally well evaluated programme that delivers education, engagement and improvements in clinical practice and carbon reductions. It's a well-established programme that we run at the Centre for Sustainable Healthcare. The second service that we wanted to look at commercialisation for is our SBRI Academy. And through the Academy, we work with QI, sustainability and educational leads to integrate sustainability principles and measurement into existing quality improvement teaching and processes in NHS organisations. And through that, we provide tailored expert mentoring and a community of peer support for the people that are involved in the Academy. Next slide, please. So our aim with phase 1 SBRI funding was to support, gain support and funding to commercialise our services in order to ensure that we've got a sustainable income and a delivery model to ultimately deliver our ambition, which is to integrate sustainability into all healthcare improvement, with the overall aim of empowering clinicians to make sustainable changes in their clinical practice and workplace. The strength of the Centre for Sustainable Healthcare as an organisation is that we're largely mostly clinicians or public health professionals, so have a strong understanding of healthcare delivery, but have less business development experience. So the SBRI funding really was kind of helping us to deliver a business model. So we started phase 1 in a strong position because the services that I mentioned were, well, particularly the Green Teams competition were tried and tested service model, not so much with the Academy. But we had strong relationships with NHS partners and education institutions, and people were approaching us for wanting consultancy around sustainability and quality improvement. But we were aware that we were in a strong position in a way that there was a demand for the services that we were offering. But we were really keen to use phase 1 to support us to work with business partners. As I said, that was kind of our weakness, to help us build our commercialisation approach through market research and product validation of the services that we offer, and to help us develop a sound business plan, alongside helping us develop internal capacity in terms of building our team, so building some new roles in the team, and also developing our external platforms that we use to sort of network with the people that use our services. Next slide, please. So the areas that I've just mentioned became our 4 kind of key delivery areas for phase 1 and the subsequent work programmes that we were working on. So we partnered with a market research consultancy, Glasshouse Health, and also Kent Surrey and Sussex Academic Health Science Network to look at our market research and product validation proposals and help us develop a strong business plan. The funding also enabled us to build capacity in our clinical team, which I talked about, and also helped us to work with an external company to build our IT and external platform infrastructure. And also we started through phase 1 to look at what our organisational needs were with our customer relationship management systems as well. And the other thing we've done with phase 1 is work with Oxford Academic Health Science Network to use their expertise in public and patient involvement as well, so which has been a really brilliant experience for us. And next slide, please. Final slide. So in terms of tips, and a lot of this is similar to what we've just heard, really, making net zero the core of your proposal. So this was pretty straightforward for us, given the sort of driving force of CSH as an organisation. But we still had to make really clear and be really sure that we could evidence the carbon footprint of delivering the services that we deliver and the actual impact that they would have in the longer term. Finding strong partners to build your expertise, sort of acknowledging where your weaknesses and expertise is, and building strong partnerships, which obviously we've had talks with people about support that they can help you do that with. So this was really key for us in terms of that business planning and market research. It sounds really obvious, but making it really clear what problem your project brings, what problem you're trying to solve, and how your project brings a solution to this, as we just heard, and being really clear about what success would look like and what the impact of your offer is. And again, just to reiterate, if you are successful attending all of the SBRI workshops, they were really helpful for us. In particular for us, as I've described, we had less experience in sort of business modelling, so they really helped us to sort of develop our understanding around value propositions and developing our business plans. So I can't stress enough how helpful they are, and just all of the connections that we've made as well, and the support offered by the SBRI team and Greener NHS. So any questions? Obviously, I haven't got my email here, but I can pop that in the chat if anyone wants to have us any questions after this at all. So thank you.
Thank you very much. That was very helpful. Our next speaker is Luis, who is a senior program manager in the SBRI team, who will provide you with some information on the assessment process for this competition and how to apply. Luis, you can go.
Thanks, Fran. Good afternoon, everyone. And thanks also to Catherine and Nathan for an excellent presentation and all of the really helpful advice they have provided to potential applicants to strengthen their applications. They've all been so helpful. Next slide, please. So I'm going to be covering the assessment process for the current funding call. So currently, we just put out the invitation to tender, where you will find the details of the current challenge, which have been covered by the previous speakers from the Net Zero Greener team in the NHS, and also by Antonio. And basically, as it stands, the assessment process you can see on the screen, you will have a short online application form, which will be made available and open for you to complete from the 31st of October. However, this is already available online, the template, so you can go and check it out on our website. I'll give a bit more detail around how to access this later on. And you will also be asked to put together a 3-minute video pitch that will form part of your application. I'll also provide some more details around this later on. This will then be reviewed by a pool of clinical, commercial, and sustainability experts, alongside a review process by the Greener NHS team, which will evaluate your application against the priorities from the challenges that have been previously presented. This will then be reviewed and ranked against all the applications will be ranked against each other, and then the decisions will be released sometime in the beginning of the year of 2024. So sometime in January, we should have the outcomes being announced. Again, just to reiterate that these are projects that are up to 12 months, and the funding will be between 50K and 100K. Next slide, please. In terms of the criteria, so we have 7 core assessment criteria that you should take in consideration when putting together the application. This, as you can see, will have different weightings between them, and they will touch on different parts of your project. So one of them is how well your application has addressed the challenge brief, and the benefit that will bring to the NHS. Have you considered a good risk mitigation strategy, the level of innovation of your product, and how you will develop and protect your intellectual property? Does it have appropriate implementation plans in place and the suitable mechanisms for scaling up? Also, considering the equity of access of your innovation, the right skills and expertise within the project team that will be delivering it, and also finally, if the costs have been justified and appropriate. So we need to ensure not only this broad assessment criteria, but also specifically for this call, how does it address the priorities described on the challenge brief and the wider net zero priorities too. Next slide, please. So In terms of the application process itself, and when you will start preparing your application and reading more details about it, you can access these details in our website on sbrihealthcare.co.uk, which has been a newly revamped website that you can check online. And you will find there at the top, when you click on competitions, open competitions, and then you will find here competition 24, delivering a net zero NHS for a healthier future. And you will click on that. That will take you into further details around the current funding call. Next slide, please. Once you open the competition webpage, you will be taken into this landing page, and you will see here all of the details that you need to start preparing your application. So you can already start preparing your application right now, and we would strongly advise you to start now instead of waiting until when the application opens on the 31st of October, and you will have all of the details that you require that to already make a head start. So as you can see there on the left-hand side, you will find the dates. So it will launch on the 31st of October, and then you will have just over 3 weeks to prepare it. So we would recommend that you draft your application and use these 3 weeks mostly to just copy paste information onto the application form and onto the portal itself. You'll find a few documents that will help you through guiding the draft of your application. You'll find the invitation to tender, the challenge brief, the template of the application form, the finance form development agreement, and the applicant and portal guidance. And within that applicant and portal guidance, you will find more details around how to fill in the application, and specifically some more details around the video format as well. Next slide, please. And just to quickly touch that, this video pitch that you will need to submit is a 3-minute video. It needs to be in MP4 format up to 40 megabytes, and you will need to upload the video into a file sharing platform that is kept privately, but do not upload your video to a streaming service or to your institutional SharePoint, as this will not be accessible to us. Next slide, please. So once you access the research management system by clicking on the top right-hand side of the competition page, you'll see, as I showed in the previous slides, you'll see a link there to access the portal. You will then, if you have not registered with us before, if you have not previously submitted an application for SBRI, you will need to create a new account. So you will need to register there, and this will need to be manually approved by our staff who manages the system. Please bear in mind that this approval only takes place between Monday and Friday, and there might be a couple of days for it to be approved by your staff members. So please bear this in mind when you are preparing your application, and when your co-applicants or collaborators are also putting together their profiles to join the application. Next slide, please. Once you log into the portal, you will find this landing page, which will show on the left-hand side a few links, and more importantly, one around managing your details, where you will fill in your CV and your experience and all your relevant personal information as a lead applicant. And then you will find there under new grant application a button to click, a link to click that will take you to the currently open application competitions for you to apply for. So once you click on that, you will be taken to a page. Next slide, please. Which will look something like this, where you have the grant type, the funding round, the closing date, and also a link for you to apply. So you will find there the date, and by clicking that link, you will be taken into the application page. Next slide, please. So this is the landing page for you to fill in the application form, and these are on the left-hand side. You will find there each of the categories that will be made available to you for you to fill in the form to submit your application. You will find some question mark prompts as well under some of the categories, which we would recommend that you read carefully through those to ensure that you understand the guidance that for each of the categories, each of the sections of the application. And you will see also that each time for each section that you fill in, you will find a green tick box next to it to indicate that this has been completed. And you do not need to complete the form all in one sitting. You can always save and close, as you can see there in the top right-hand side, a button that you can click to save and come back to it later on if you choose, and complete the application at another time. Next slide, please. One point to note is that if you want to have what we call co-applicants, but in this case, not institutional co-applicants, because you can't have co-applicants, only subcontractors and collaborators. But if you would like to have anyone that would be a collaborator in your application, that will need to basically be listed in your application, please bear in mind that they must first have an RMS account, a research management system account. So they will also need to register, and this will also need to be manually approved. And make sure that they register sooner rather than later, because if they only register after the deadline, you will not be able to submit your application, and we will not accept any late submission. So please bear this in mind and make sure that any collaborators registers as soon as possible. Next slide, please. So once they register and they are listed as collaborators, they will be taken into this page where they will be able to confirm or reject their participation in the application. So they will need to click confirm in order for everything to be ready for submission of the application. Next slide, please. So that's it from our side. In case you have any questions, please feel free to contact us. We are open to any questions now if you would like to ask anything from us or from Nathan or Catherine, for example. All of the information that has been presented here in today's session is also available on our website, on the competition website. So we would strongly encourage you to read carefully through those documents, through the PDFs that are available, and start preparing your application as soon as possible to submit during that 3-week period from the 31st of October. Thank you.
Thank you, Luis. I cannot see any open question in the Q&A box. Is there anything that any of our previous speakers would like to add in this time that we have while we wait to see if there's any other question from our attendees? No? Okay. In that case, I would like to thank all of our panelists for a very informative session, and I would like to thank a question. Ali asks, not everything that counts can be counted. For example, sustained behavior change. Can innovation in this area be included? I believe that this might be a question for the greener team, if Fanny is still on the call.
Yeah, hi. Yes, I'm happy to take this one. I guess the question is to be able to sort of try to measure or quantify impact of behavior change in relation to delivery of care. And can appreciate that it's difficult to account for that. I think we would be open to innovation in that space, but bearing in mind the sort of category, whether that's perhaps category 1 or category 3 of the challenge brief, related to the clinical engagement or the clinical transformation in the care pathways. I think the only thing I would say is there's always some predicted impact that kind of needs to be modeled somehow. So we would sort of welcome some modeling of the impact that innovation approach could have, and why this is something that we should be supporting, and that would strongly help us reaching our carbon reduction targets. And we still need to be able to have visibility of that. We completely understand that supporting healthcare professionals and the workforce is a big part of helping us reaching our targets, but we've got to kind of understand what the impact could look like and have an idea of that. So completely understand the challenge associated with that, but we would welcome this kind of innovation around sort of supporting the healthcare professional and supporting behavior change, but trying to sort of explore potential models to measure the impact of that would actually be really, really helpful in as part of the assessment process.
Thank you. Next question is, do you have to have an NHS trust that's backing up your proposed solution before you submit your application? In terms of eligibility, it's not compulsory to have subcontractors. However, we think that it might be beneficial for projects to work with a trust. I don't know if Fanny wants to add anything to these in terms of what the Greener team would appreciate to see a little bit more.
Yeah, I think obviously we've got to sort of have a strong focus on the impact on the NHS from a net zero perspective. And we appreciate that sometimes early stage innovations are still in the sort of, sort of early development, and they're not necessarily ready for testing with an NHS site. I think typically from my experience in innovation and in net zero, it's really important to be able to engage with the potential users or the potential sort of recipients, but also the patients, to make sure that you sort of strengthen your case for implementation and adoption in the NHS. So we would recommend it just to sort of have that link with the healthcare settings that you're targeting your solution or your innovation. So it's not necessarily a requirement, but it's just thinking about the people that you need to engage with to make your innovation successful and to be able to access the expertise, to be able to access the evidence as well. So that's more of a recommendation, I guess.
Thank you. Janet asks whether a trust can apply on its own or in partnership with other trusts. Yes, a trust can apply on its own, and partnerships with other trusts are welcome. Again, as Antonio mentioned earlier, we will only contract with one entity, and that would be the lead organization that will put the application forward. So any organization that will partner with the lead organization would need to be included in the application as a clinical partner or a subcontractor. Can an organization submit 2 applications if each application is for a different or innovation? Yes. Yes, that is possible, as long as they are different innovations or the projects are different in scope, and they're quite different from each other.
And just to add to this question as well, you need to regard on the times that you will be committing to each project in the event that both of them get awarded. Obviously, you need to see whether you can actually commit to everything.
I'm going to wait for a couple more minutes to see if any other questions come in. But in the meantime, I will just give a couple more information. So we will be organizing a Q&A drop-in session where you can ask any additional information during your application process. And that will be held on the 24th of October, 2023, from 1 to 3 p.m. So by then you will have the time to read through the application form, guidance for applicants, and all the remaining documentation, and are welcome to come ask us any question related to the application process. And there is a link in this slide to subscribe to our newsletter, so you can hear all about our new competitions, any kind of event we might be organizing. And I see there's no more questions, so I would like to thank all of our panelists for a very informative session and for taking the time to join us today for this webinar. And I would like to thank all of you attendees and for joining us today. And if you decide that you want to put in an application for this competition, I wish you all good luck. And for me and the rest of the SBRI team, have a good afternoon and a great weekend, everybody.